I'm Carol Duggery. I am the program manager for the Technology Assisted Children's Home Program. Just want to test and make sure everyone can hear me well. I'm hoping that everyone had a lovely and relaxing holiday weekend. It looks like I'm hoping that everyone can hear me. I hope so. Sounds like everybody can. So I just wanted to say thank you for attending. So this morning, just a couple of housekeeping items. For those of you who are with us in the room, I wanted to make sure that you are aware that we do have laboratory facilities are out the door here to my right, by my right hand here, and down to the laminate flooring, and then take a left, and that's where the bathrooms will be. And there are also out the door here to my left hand are water bottles and a coffee. So thank you, and a huge shout out and thank you to IU19 and Kelly Dickey for allowing us to utilize this beautiful space, and also for her technology support as well, for allowing us to have this amazing opportunity to be here and to use this hybrid technology. We're very excited to be able to offer this presentation in a hybrid manner. For those of you who are online, I just wanted to highlight that we will be offering ASL options as well. And our interpreters, I believe, are Cheyenne and Allison. Dina, did I get that right?
Michelle.
Okay, and they will be spotlighting themselves throughout the presentation, is that correct?
It's for some reason it's not letting them spotlight. They're gonna pin themselves. I don't know if when you're done, we can ask Cheyenne if she would like to just give a quick overview of how folks can do that. Either she'll pin or they will be able to pin her themselves, anyone who needs to see her.
Okay, so Cheyenne and Michelle. Okay. All right, so thank you for having that service available as well for our families and caregivers. Also, as we go forward throughout the presentation, for those of you who are online, please feel free to write questions in the chat as questions come to you. I know it's difficult to try to remember, until there are whole questions until the end. So feel free to write those, and we'll try to address them as the presentation is going. We will hopefully have some time at the end to address questions. And at the end, if we are unable to address your questions during this presentation, we will get back to you with answers after the presentation. So definitely write down your questions as we're going along. So we appreciate those. What I'd like to do now is talk a little bit about our presenter that we have with us today. So today we have with us Janice Miner from the Pittsburgh office of the Pennsylvania Health Law Project. So Janice is going to be our presenter for today. And I have Janice's bio right here, so I just have to pull it up, so give me 1 second. So I apologize for that, not having that in front of me. Oh, I forgot that the speaker will follow me as I walk. So look at that, look at me being all technological. Sorry about that. Sorry. My computer went blank. Sorry about that. Okay, so Janice is a paralegal in the Pennsylvania Health Law Project's Pittsburgh office. She is a master's level social worker, and she has been with the Pennsylvania Health Law Project since 2000. Janice's expertise focuses on access to behavioral health services for Pennsylvania Health Law Project's clients. She has authored The Many Doors to Consumer Empowerment and How to Obtain Mental Health and Drug and Alcohol Services in Pennsylvania. Janice is honored to be part of the dedicated and compassionate Pennsylvania Health Law Project team and is an avid supporter of quality and accessible healthcare for all. And I know that Janice was a recent award winner. Dana, can you tell me again what was Janice's recent award was?
Yeah, absolutely, Carol. I'm glad to do that. I'm sure Janice loves that we're giving her all these props right now. But earlier this year, Janice received the 2024 Excellence Award from the Pennsylvania Legal Aid Network. And they award that. She got that award in the non-attorney advocate category, and it really recognized all the great work Janice has done over her decades-long career. So we're really proud of her.
Thank you. Thank you very much. And we're thrilled to have Janice with us today. So thank you, Janice. And thank you, Dana. And thank you, Pennsylvania Health Law Project. And we are super excited to get this underway. So Janice, please take it away.
All right, great. Dana, do we need the folks doing the ASL to tell anything, tell us anything before we get started?
I'm just going to pause for a minute and see. Cheyenne and Michelle are both panelists. They should be able to unmute if they need to. So we'll just see if they want to say anything.
Added chat to make me larger. There should be 3 dots in the top right corner of my screen. You can hover over that, click it, and then select add pin. And that should be good. Thank you.
And I'll just note, if folks are trying to minimize Cheyenne from the window, you can click the top left pin button. It says switch to shared content, and that will go back to the PowerPoint slides. Thank you.
Thanks, Cheyenne. Thanks, Dana. I also just wanted to make a final note. For folks in the room, we do have box lunches coming at about 11:45. So please grab and go or stay and eat. Like, take your lunch. So good morning, everybody. I appreciate everybody being with us this morning, especially after a long holiday weekend. First thing back, our faux Monday morning here. So thank you so much for joining us online and the folks in the room as well. I do want to spend, let's see if I can get my clicker going here. I do want to spend just a couple minutes this morning talking about our organization, where Dana and I both work, the Pennsylvania Health Law Project. So for folks who are not familiar with us, you have a sense of who we are, what we do, how we can be a resource to anybody, people you're working with or individuals themselves who are listening in today. So the Pennsylvania Health Law Project is a statewide nonprofit law firm or a public interest law firm. And our work focuses on helping people access public health insurance programs. And so in Pennsylvania, when we're talking about public health insurance programs, we're primarily talking about Medicaid, or what we generally call medical assistance in Pennsylvania, CHIP, the Children's Health Insurance Program, and we also help people with Medicare, especially low-income Medicare beneficiaries. And so we help people both with eligibility for Medicaid and for CHIP and for Medicare. And then we also help people with access to services, in particular people on Medicaid. And generally, I think I'll refer to it as Medicaid, but again, in Pennsylvania's Medicaid program is called medical assistance. But when I use either, I'm talking about the same thing. And so we help people with eligibility for these programs, as well as access to services, helping people understand how to get services with Medicaid, kids with CHIP, people with both Medicare and Medicaid. And then we also help people with denials of services. So that if somebody is prescribed some level of treatment, a medication, a therapy, whatever it might be within the Medicaid program, and they're denied what's been requested by, by a doctor or a psychiatrist, whoever it might be, then they have a right to, under Medicaid rules, they have a right to a denial notice, and they have appeal rights within, that the Medicaid system. So that's another piece of our work. And the notices for the Medicaid managed care plans let people know that, if they have a denial, they have a right to appeal, what that appeal mechanism is. And then it gives them our helpline number, as well as their local legal aid phone number for people to get, free help, which is what we provide, as well as all local legal aid offices across the state. And so the main way folks get to us is through our helpline. That number's on the screen, hopefully in front of folks, 800-274-3258. Our helpline is generally open for intake on Mondays and Wednesdays. And then in addition to our direct client work, and really from our direct client work, we also do a lot of policy advocacy with the state officials who are responsible for the Medicaid program, trying to make improvements in the program. Clients call with an issue, we see it once, maybe we see it twice and think, is this a bigger issue? Is this a systemic issue? And then we raise those issues, through the appropriate state Medicaid offices. And then the third kind of bucket of what we do, client representation, policy advocacy, and then community education. Things like we're doing this morning. We do webinars, we do in-person presentations, and we create a lot of written material, and people can have the link right there on the PowerPoint slide, for lots of written materials, everything from a one-page fact sheet to a 30-page guide on the medical assistance, Medicaid eligibility in Pennsylvania. So if, folks are having any issues related to, they're uninsured and wondering if they might be eligible for insurance like Medicaid or CHIP for kids, or they're, got the Medicaid insurance, but they're having trouble accessing services, they can't find providers, or, they're just not understanding how to access services. Maybe they have commercial insurance through somebody's employment and Medicaid. So then you're trying to manage, how do I access services when I have more than one insurance in addition to Medicaid, and certainly any service denials through Medicaid. Those are all appropriate calls for the Health Block Project. And then folks also have, in addition to the helpline, you have my direct email and my direct phone number as well. And in particular, as Carol mentioned, if we don't get to all the questions today, or, questions often pop up later, or, when there's a real person in front of you and the situation is, now right before you with questions related to, anything that we cover in terms of today, or, broadly in terms of Medicaid, feel free to reach out to our helpline or to contact me directly. And then this is just, I think, pretty much covered, just giving folks some general, not all inclusive, but just some general ideas of, when to call us. But our work is very specific to, public health insurance programs. So even though we're a law project, obviously attorneys do all kinds of other work. Our work is really very specific to the public health insurance programs and Medicaid and Medicare and CHIP in particular. So today we're going to talk about specifically in terms of the Medicaid program, we're going to talk about eligibility for Medicaid. And Medicaid's a complicated program. And not easy to navigate, not easy necessarily to understand all the eligibility criteria. So we're going to talk through those today, give some examples of when people might be eligible for Medicaid, talk briefly about how to apply, some tips hopefully in working with the county assistance office. Those are the local entities that are processing people's Medicaid application. And then talk a bit about Medicaid renewals, because when somebody's determined eligible for Medicaid, they're not determined eligible for Medicaid indefinitely. They have, generally an annual renewal, in some cases, even a semi-annual renewal. So really important for people, not just to, get Medicaid when they're eligible, but that they keep the Medicaid if they continue to be eligible. And we see lots of issues with what the system often refers to as churn. People on Medicaid, off Medicaid, and then back on Medicaid when, in the interim, they really should have been eligible, but something went wrong in the system. And that's often tied to a renewal. So we'll talk a bit about that. Okay, so just starting first with just some Medicaid basics and some Medicaid, eligibility basics. So we have Medicaid and Medicare. So I feel like coming right out of the gate, why the feds decided to name them something so close. We probably don't go a week at the Health Law Project without some client or somebody saying to us, Medicare, Medicaid, I don't even know which one I have. So two totally separate health insurance programs. And we're focusing today on Medicaid, or again, what we call medical assistance in Pennsylvania. So, and Medicaid is the federal name, and then different states often have their own name for their Medicaid program. Medicaid is a both federal and state program in that both the rules and the funding come from both the federal government, specifically the Center for Medicare and Medicaid Services, and the state government. Funding is about 50 cents to 50 cents on the dollar in terms of, where does the money need to come from? The feds are, basically giving 50 cents for every dollar of Medicaid dollars spent in Pennsylvania. Medicaid is primarily a program for people who are low income people with or without disabilities, seniors, people, kids, pregnant women. Really anybody can potentially qualify for Medicaid, but it is, it's a needs-based program. And so with an exception that we'll talk about later, income is important in determining whether or not somebody might be eligible for Medicaid. Lots of ways to qualify for Medicaid. Everybody who's on Medicaid is on Medicaid in a category. It's not unusual that people have no clue what that category is, because generally it's really not kind of a talked about piece of the process, the eligibility in particular. So people apply, they're deemed eligible. They don't necessarily know that, because they're pregnant, they're in the pregnant woman category. But everybody has to fit, in order to be eligible, somebody has to fit in a category. And we're going to spend a lot of time today talking about all those categories. And then talk through how those categories have income limits. Some categories have both income and resource or asset limits, and talk through how even income gets counted differently in different categories. And then people can have Medicaid as their only insurance, or they could have other insurance in addition to Medicaid. So people do not have to be uninsured to get Medicaid. When people have more than one insurance, in addition to Medicaid, Medicaid's always the payer of last resort, meaning, it pays after whatever that other person's other insurance is. And that becomes important in terms of, how do I access care? Because then when I have some other insurance in addition to Medicaid, the Medicaid isn't kind of driving the train. It's that primary insurance that folks need to be kind of keying into first, in addition to their Medicaid. Often the reason people have Medicaid in addition to other insurance is because the other insurance is not as good and comprehensive as Medicaid is. And Medicaid is good, comprehensive health insurance. Okay, so just general, starting first with just the general eligibility for Medicaid or medical assistance in Pennsylvania. People do have to be a Pennsylvania resident. To be determined a Pennsylvania resident, you have to be here with the intent to stay here. So that's it, as opposed to I'm here visiting, and I'm here for a week or a month or the summer. You're here with the intent of staying in Pennsylvania, then you're considered a Pennsylvania resident for Medicaid eligibility purposes. As I said, everybody has to fit a category. So you have to figure out what category somebody needs. Then within that category, there are income limits, right? Or is the individual, applying within the income limits? Some of the categories have resource limits in addition to income limits, some don't. So then depending on your category, will determine whether or not we're also, needing to pay attention to money people may have in savings or checking accounts or retirement accounts, where that matters. And then, in terms of people's citizenship or immigration status, that's another 2-hour training in and of itself. But, an individual's, somebody's a US citizen, they're a US citizen, good to go, there's no questions. If somebody's not a US citizen, then they can still be eligible for Medicaid. It just depends on lots of factors, like, are they children, are they adults, what status, are they undocumented, are they documented, in what way are they documented, do they have, are they a legal permanent resident? That factor matters, but as I said, we're not going to get into all those nuances today, because that's a complicated, question in and of itself. If somebody says, can an immigrant get Medicaid? Maybe. Yeah, I mean, yes, they can, but under what circumstances? That's a whole nother train. Okay, so generally kind of what, like when folks call us, at the Health Law Project, uninsured, underinsured, wanting to know just generally, am I or somebody I'm calling on behalf of, eligible for Medicaid? We're, right away keying into, getting more information from this person or about this person in terms of, do they fit a category? They fit a category, then we're looking at what's the person's household size. And household size can vary based on the person's category in terms of who's counted or who isn't counted in somebody's household. And then what's the person's, or the household income, and when appropriate, when it matters, what are their resources or assets. And there's no such thing as, family coverage for Medicaid. So a whole family could be eligible for Medicaid, but they're not a family. There is no such thing. That isn't how Medicaid works. So if somebody calls us at the Health Law Project, that insurance, they were working, that insurance, all was great, and then the person with the insurance tied to that job loses their job. And that insurance was covering, 2 parents and 3 kids, and now they're all uninsured. When they may call us at the Health Law Project, or they just apply to Medicaid, every one of, the 5 people in that household are being looked at individually. one or two or three or four or all five could be eligible. But there's, and the income in that household certainly can affect, who's eligible and who isn't. But, we're looking at every person individually. Children, how old are they? Do those kids have disabilities? Parent, is the parent pregnant or not? Either parent disabled. But looking at each one of them individually, and some or none or all of those 5 people in that family might be eligible for Medicaid. But as I said, there is no such thing as like, well, either the whole family is eligible or the whole family isn't. It's one person at a time. So as I've mentioned, and you'll hear me mention again, the categories of Medicaid eligibility. People have to fit a category. Prior to the passing of the Affordable Care Act, what some people refer to as Obamacare, it was harder for adults in particular who weren't seniors, or weren't pregnant, or weren't disabled to get Medicaid. But the Affordable Care Act opened Medicaid up for people, for adults who were simply low income, which was the intent generally of the Medicaid program to begin with, to make sure people had health insurance, even if they were low income. So now more people in Pennsylvania and in every other state that expanded Medicaid, even more than prior to the Affordable Care Act, which is now 14 years old, but so it made a huge difference for people, adults, really exclusively in terms of Medicaid. So lots of different categories. Adults and kids who receive SSI, which is Supplemental Security Income. And we're going to talk through all of these more, kids, pregnant women, adults with low income, kids with, disabilities, individuals 65 and older, women with breast or cervical. So all of these are categories. And this is not exclusive. It captures most of them. People can also be eligible for Medicaid because they're eligible for one of Pennsylvania's home and community-based services programs, what people often refer to as waivers. That's also people, in addition to being eligible for example, the adult autism waiver in Pennsylvania. If somebody doesn't have Medicaid, when they apply for the adult autism waiver and determined eligible for that waiver, they also get Medicaid health insurance. So lots of ways for people to have potentially be eligible for that. So we're going to talk through some of these, most of these categories. And we're going to talk about CHIP as well, because the household counting, income counting rules for some categories of Medicaid also mirror the eligibility and rules, the income household counting rules for CHIP. So we're going to talk about the CHIP, Children's Health Insurance Program, as well. So medical assistance, eligibility for kids, as well as kids who may not be eligible based on household size and household income. They may be over the income limit for Medicaid. Those children are almost always eligible for CHIP. It may be free CHIP, it may be low cost CHIP, it could even potentially be full cost CHIP that parents who are, guardian would need to be able to pay. But when kids aren't eligible for Medicaid and they're uninsured, because that piece is required with CHIP, they could then be eligible for CHIP. So kids is a category of Medicaid eligibility, and kids is actually 3 categories because the income limits vary based on the age of the child. So kids are divided up into newborns to a 1-year-old, 1 to 5-year-old, 6 to 18, or sometimes really even 19-year-olds. The younger the child, the higher the income limit. There are no resources counted under this category of Medicaid. And, you know, we'll talk through which of these categories have resource limits in addition to income limits and which don't. And we'll talk some about what is a resource, what's counted, what isn't counted. Under this category, true of CHIP as well, we're looking at household size, household income, and actually tax filing status as it applies to kids of all age groups and CHIP. But looking at the income piece only, no resource limit. And the income limits are tied to the federal poverty level. And it's federal in that it gets decided at the federal level. States don't determine that. And that federal poverty level almost always goes up every calendar year. We don't tend to know it until well into January of a given calendar year, but they go up almost every year. Not substantially, but they do increase. So infants under the age of 1, as well as pregnant women, and I think we're going to again talk about pregnant women, are eligible for Medicaid. And the income limit is, again, these are all tied to federal poverty levels. In the case of newborns to age 1 and pregnant women, the federal poverty level is at 220%. And, you know, so you see on the slides, you know, just the examples. Obviously, households could be larger than households of 5. You know, our chart just happened to go up that far. And you can see what the monthly income limits are, or, you know, converted to annual income limits. To see whether or not somebody, you know, kids, a newborn to age 1 or pregnant women might be eligible for Medicaid. And just a side note, pregnant women for Medicaid eligibility purposes are always a household of 2. So the pregnant woman, it is a household of 2. And then of course, if there's others in her household, then the household numbers go up. But so if a pregnant woman's applying for Medicaid, you're never looking at the income limit for a household of 1. The pregnant woman herself automatically counts as a household of 2. So the unborn baby is counted in this case. And then, as I said earlier, older the child, younger the income limits. So income limits for kids age 1 to 5 is at 162% of the federal poverty level. And again, the category for kids, no matter the age, only looking at household size, household income, tax filing status. So is that child a tax filer, a tax dependent, or neither? And then those rules get a little in the weeds in kind of figuring those things out. But only focused on income. We're not concerned if, you know, that child's in a household that has $1,000 in parents' checking account or $1 million in parents' checking account. Not counted in looking at, you know, eligibility. The other thing I wanted to remember to say is that when pregnant women are on Medicaid, deliver a child while on Medicaid, that child's automatically on Medicaid for the first year of his or her life. Again, and regardless of household income. It's just one of the rules of Medicaid. Pregnant woman on Medicaid, when she delivers that child has Medicaid at a minimum for the year. And then kids aged 6 to 18, again, you see the income limits coming down. It's at 138% of the federal poverty level. And again, looking at income only, no resource concerns factored into. The application is going to ask about resources. The application is, you know, going to ask, do you have a checking account with what bank? what's the checking account number? Do you have a savings account? With what bank? What's that savings account number? And what's the current balance? So the application asks that information for, a few different reasons. But in the case of kids and pregnant women applying for Medicaid, they're not factoring in what those assets are. If you have a car, if you have 3 cars, if you own 2 houses, if you own property, none of that's getting factored in. But the application does ask for those things, and people are required to provide that information on the application. And then, as I said, the eligibility, income counting rules, household counting rules for kids not eligible for Medicaid, and kids are always screened first for Medicaid eligibility. And if determined eligible for Medicaid, then they're enrolled in Medicaid. Families don't have a choice between Medicaid and CHIP. It's tied strictly to the rules determining eligibility, and then it's one or the other. And sometimes kids do go, unfortunately, back and forth because household size changes, household income changes. It obviously can go up, it can go down. And then, at that point, the child could go from Medicaid to CHIP or from CHIP to Medicaid. Unlike Medicaid, in order for kids to be eligible for CHIP, up to the age of 19, kids age out of CHIP when they hit age 19. Unlike Medicaid, kids do have to be uninsured to be eligible for CHIP. Children could be covered under, say, a parent's, insurance through their parents' employment, and parents then could determine to drop that coverage and enroll them. And generally, families would consider doing that because CHIP could be more affordable than what they may be paying to have their child covered through their employment. But that insurance would have to be dropped. So different than Medicaid, part of the eligibility criteria for CHIP is that the child is uninsured or will be, as soon as the CHIP coverage would start. And then, as I mentioned earlier, the income limits for CHIP are higher than for Medicaid. So kids in households over income for Medicaid, very likely eligible for CHIP because those income limits are higher. And then again, depending on the household size and income, kids could be eligible for free CHIP. They could be eligible for low-cost CHIP, and kids actually could get CHIP and pay the full premium, when based on household size and income. And then I wanted to touch on this category of Medicaid because this is also a category that's the result of the Affordable Care Act. And I think just helpful for people to be aware of this category because I suspect there are young people age 18 till they hit 26 that are perhaps uninsured or underinsured and don't know that they're eligible for Medicaid because they were, a former foster care youth. So if a young person at age 18 is in foster care and on Medicaid, they then remain eligible, or if they lose that eligibility, can become eligible for Medicaid again, no matter their income or their resources, and up until the age of 26. So I think just a mechanism put in place, I would imagine, to try to help what would be generally probably considered a very vulnerable population. If you're an 18-year-old in foster care and aging out of that foster care system by virtue of being in foster care could mean you don't have a lot of supports. And so this addition to the Affordable Care Act is allowing those, those young people trying to get their start in life, with at least the benefit of healthcare, and health insurance to access healthcare. So, but, just as I said, that 18-year-old has to have been, and perhaps older. Generally, I think kids age out of foster care at 18. But, it might be that they were still in foster care till 19 in some circumstances. As long as they were, in foster care and on Medicaid, they remain or can apply and be eligible no matter their income at that point. Okay, so another category that, I referenced earlier is medical assistance for kids on SSI. And these rules are all applied for, adults, anybody of any age who's on SSI. So SSI is supplemental security income. It is a Social Security disability income for people who are determined disabled under Social Security Administration rules. And when they're determined eligible for a Social Security, this particular Social Security benefit, so not to be confused with SSDI, which is Social Security Disability Insurance, also an income benefit through the Social Security Administration. But when people are getting this specific income benefit from Social Security, SSI, Supplemental Security Income, then those kids and adults are automatically eligible for Medicaid. They don't necessarily even have to apply. They can, because sometimes that Social Security, that SSI determination doesn't happen quickly. So somebody could apply for SSI while they're waiting on that determination. In particular, if they're uninsured or underinsured, can also be applying for Medicaid, simultaneously. But once somebody is determined eligible by Social Security for SSI, that information gets communicated from Social Security systems to the state Medicaid system, and they are then to be automatically enrolled in Medicaid and would be in Medicaid in that SSI category, or what's generally coded as the J category in the Medicaid system. And as I said, this is also true for, for adults getting SSI. And as long as somebody remains on SSI, Social Security continues to communicate that information to the Medicaid system, then their Medicaid continues. And that they don't have annual renewals. If they only have Medicaid and under this category, not in a Medicaid waiver, for example, they don't have an annual renewal the way most everybody else on Medicaid does. Basically, then SSI equals Medicaid. So kids who are not eligible for Medicaid based on household size, household income, and tax filing status can still be eligible for Medicaid depending on if they have a significant health issue or disability. Is under this category, coded as the PH95 category, household income is not counted, as well as any assets or resources that family or parents have in that household. So kids are always screened first for Medicaid eligibility based on household size, household income. When they're determined over income, often then they can get referred to CHIP, as I said earlier. However, if this is a child with some significant health issues or diagnoses, they could still be eligible for Medicaid based on those diagnoses. And so, and these are kids who perhaps have disabilities but are not eligible for SSI. Under this category, Medicaid requires families to apply for SSI for kids. SSI is going to screen the family first for income eligibility before they even get into any discussion about what are the child's medical conditions. They're going to look at, Social Security is going to look at what's the household size, what's the household income, what are the household resources. And if Social Security says, you know, it doesn't really matter going forward if your child has a disability or not, that, you know, they're not income or resource eligible for SSI, then it just asks Social Security, you know, will you send me that in writing? Just need a letter from Social Security indicating my child is not eligible for SSI, and the county assistance office will typically ask, you know, for that proof. But that doesn't impact then their eligibility for Medicaid, you know, under this category. So when families are applying under this category, and don't always know necessarily that they are, but you know, when they know about this category, and families, of course, often talk to one another and educate one another. You know, people think, oh, my child couldn't get Medicaid. You know, we make $80,000 a year. First of all, depending on the household size, maybe your child is eligible, but you know, if not, and this child has a disability or some, you know, significant diagnoses, they, you know, they then can be eligible under this category. But so in addition to completing the Medicaid application, still including the income information of the household and the resource information, still providing proof of family income, because as I said, that child's going to be screened first under the regular children's category of Medicaid eligibility. But then in addition to that completed application, the documentation required, then the families also need to be providing information and documentation of the health conditions or disabilities. So that then they can be reviewed by what Medicaid calls the medical review team, and looks at, you know, what is that, you know, what is the diagnosis, what's the documentation about the child's health conditions, you know, do they meet the definition of, you know, a child with a quote unquote disability. And when they do, then they could be eligible for Medicaid, you know, in this category. And like kids on CHIP and Medicaid, who sometimes bounce back and forth between Medicaid and CHIP because of changes in household size and or income, that the same can be true for Medicaid categories for kids. So kids could be on Medicaid, you know, in this disability category, have an annual renewal. There was a change, you know, the household size went up or the household income went down. Then that child remains perhaps on Medicaid, but, you know, in the children's category, not, you know, in the PH 95 category. Those things almost always happen seamlessly and behind the scenes. But I think sometimes can be helpful for families to know, you know, how their child is eligible. Because, you know, sometimes parents think income isn't supposed to be counted because they think their child's in a PH 95 category when maybe they were in a disability category. At the most recent, you know, annual renewal, something changed in the household size or income. And now they're, you know, in the category for kids. It just, you know, sometimes can make a difference for families to know. Okay, and I think pretty much, you know, covered this. The piece I really want to stress for this category, Medicaid eligibility for kids with disabilities, is that this category ends at age 18. Talked to many families over the years that were surprised to know that and didn't realize that. Just really trying to stay in touch. Okay, I'm sorry. Go ahead. Yeah, so this category, so when kids are eligible for Medicaid under this disability category, this category ends at age 18. And a month or two ago, back in March, I think it was, we did a webinar with the Social Security, with a representative from the Social Security Administration, talking just about Medicaid eligibility for transition age youth. Transition in this case being kids on Medicaid at age 17, approaching 18th birthday, and depending on how, under what category that now 17-year-old has Medicaid, parents may really need to be keying into, what might happen then when they turn, when they turn 18. Because any, 17-year-old who's on Medicaid prior to, hitting that 18th birthday in this PH 95 category, excuse me, that category ends at age 18. So, and I think it's another reason why it can be helpful for parents to know as it gets closer to that child's 18th birthday, what category of Medicaid are they, especially when they know they have a child with, a disability or some significant health issue. Because they are going to get notified by the county assistance office that their Medicaid is ending. Now, the Medicaid system, the county assistance offices are supposed to be screening that now 18-year-old for other potential categories of eligibility. That doesn't always happen like it's supposed to. And so sometimes, and even when it does happen, families could be getting that notice saying, your child's Medicaid's terminated because they're now 18 and this category ends at 18. And so, families that have questions about this or, are in that situation where, they've got a 17-year-old soon to be 18, it's something better, better sooner than later to be keying into and not get that unexpected Medicaid termination notice to find out that their child's Medicaid ended. And I think this also gets confusing for families because under the Medicaid access to services rules, kids are determined kids until they turn 21. But that's talking about when a child's already on Medicaid and getting perhaps, into behavioral health services or getting, in-home home health aid services or in-home, shift nursing services. Those services that are available to kids on Medicaid, the federal government says kids in this, situation are kids until they turn 21. So if my child's in need of, ongoing skilled nursing in home, in school, in both, that my child could continue to get that as a paid benefit under Medicaid until their age 21. That's different than their eligibility category. So if they're eligible for Medicaid as a child with a disability, their Medicaid under that category is ending at 18. And obviously access to those services they may need ongoing and can potentially still get till they're 21, they're going to end if there's not another category that fits. And that webinar is on our website. I'm sure Dana will correct me if I'm wrong, but if folks want to just take a look at that information about what both on Social Security end as well as on the Medicaid eligibility side, what might families want to be paying attention to when their child with health issues or disabilities is 17 and approaching that 18th birthday. Okay. So now we want to shift to Medicaid eligibility for adults. As Carol said earlier, please, as you have questions and they're popping in your head, please put them in the chat, and then hopefully we're going to get through some of those questions. So lots of, as you can see, different categories of eligibility for Medicaid for adults. just like with kids, category that's for people receiving SSI, the Supplemental Security Income. Adults with permanent disabilities, individuals 65 and older, individuals working with disabilities, one with breast or cervical cancer, low-income adults under the age of 65 who do not have Medicare. That is that Medicaid expansion category I referenced earlier. It's tied to the Affordable Care Act, and pregnant women. So again, just as I said with kids, nothing different here. If an adult is determined disabled by Social Security Administration and eligible for specifically the SSI income benefit, the Supplemental Security Income, then that again equals Medicaid. Adults getting SSI, kids, anybody, any age in Pennsylvania getting an SSI check, they're automatically eligible for Medicaid. And that information continually is communicated from Social Security to Medicaid. Then there's another category for adults that the system refers to as the Healthy Horizons category. Potential eligibility for this category is for individuals 65 and older, as well as people under age 65 who may be, getting, Social Security disability, and may or may not also have Medicare. People 65 and older who've worked, paid into the Medicare tax system, become Medicare eligible at age 65. People who work, pay into the Social Security and Medicare system and become disabled prior to the age of 65 have enough work credits to get a Social Security benefit, a disability benefit off their own work history. That benefit is called SSDI, Social Security Disability Income. After 24 months, those folks become eligible for Medicare, but again, separate from Medicare, could still be eligible for Medicaid. So the Healthy Horizons category, again, all tied to the federal poverty level. So for people under 65 receiving Social Security disability, or people who are 65 and older, income limit is at 100% of federal poverty. And you see what those income limits are. Unlike the prior Medicaid categories we've talked about up until this point, as well as unlike CHIP, where we're only looking at household size and income. Now we're moving into some categories that also look at both income and resources. And the resource limits are generally pretty low. So as you see in this category, in order for somebody to be eligible for Medicaid, they have to be under the income limit and under the resource limit. So if the person applying is single, that resource limit is $2,000. So can't have more than $2,000 in checking, in savings, in investments, in a retirement account. For a married couple or a family even larger than married couple, well, let me slow down. The resource limit is $3,000. If there are kids, dependent children, dependent to the applicant, in the household, then resource limits don't count in that instance. Otherwise, under this category, you're looking at both the income limit and the resource limit.
Janice, we had a question that came in through email, and I'm thinking that this might be a good spot. So the question came in last night, actually, from a participant who's actually online today. So I'm hopeful that everyone can hear me okay, our online participants. So it's a two-part question. It's a two-part question. So it is a, father, his son is 33, so I think that he would fall into this section. So his son is receiving, SSI and Medicaid. And SSA DHS is currently reviewing his continuing disability status. Wife started, so dad states that his wife started receiving Social Security retirement payments in March. So the SSA DHS wants him to receive SSD from her work history, which would be $512 per month at the 50% ancillary beneficiary rate. And the balance would be $431 per month from the SSI fund. The possibility of receiving some SSD is what triggered the review. So he has two questions. The son suffers from delusions, so paranoid schizophrenia, which prevents him from joining a Zoom call with the IMA group of doctors to evaluate him. His delusion was that he did not need to join the Zoom. So his disability is preventing him from establishing his disability. Okay, so this is the first. He has another call with the IMA group scheduled now for June 3rd. I was told by the Bureau of Disability in Harrisburg that if he does not join the Zoom, he will be found no longer disabled and lose benefits. So Dad says that, he highly doubts that he'll be able to join the call on June 3rd. And thus losing his benefits. So what can we do to correct this catch-22 situation? So that's question one. Question two is the disability review was triggered by the potential for his son to receive the SSD. If he is found not to be continually disabled, will he still get the SSI and Medicaid?
Okay, so, and, Cheyenne, can I ask you to, why did I lose her? It was on my screen. I was gonna ask her to just shake her head for us if folks heard those questions.
Yeah, that would have been a good test, sorry. I can go back.
For whatever reason, she just, maybe they're switching.
Oh, maybe they're
from
switching.
Cheyenne.
Yeah.
Hey, folks, this is Dana. I can hear very clearly. The sound is great.
Great, thank you. Okay, so the questions are all really tied to Social Security and his disability, which is first not our area of expertise.
Okay.
So, yeah, but in terms of the disability benefit, I mean, again, we're not experts in Social Security, but my sense would be, because they're now reviewing this triggered a review by Social Security Administration of whether or not his 33-year-old son continues to meet definition of a disability, then yes, I would think his SSI is also in jeopardy, because his SSI is also tied to determining whether or not he's disabled. But yeah, I would, I don't know whether legal aid, I think they probably could. I would call the local legal aid office. And you can certainly email, like my email back if that doesn't know who or how to find a local legal aid office to get help with the disability piece.
Okay, thank you.
And then around Medicaid questions, in the what if scenario, please direct it down to me. But yeah, unfortunately, we're not experts in Social Security, so.
Okay. Thank you.
Sure. Okay, so income limits and again, resource limits with this category, unless the applicant has dependent children under the age of 21 living in their household, then we're just looking at that resource piece. It's disregarded. Otherwise, it's always counted in this category. Another category of medical assistance, and this category would be viewed, considered if somebody's not, if an adult with a disability is not eligible under that prior Healthy Horizons category. So the medical assistance for workers with disability category is for people, as the name implies, who are both working and disabled. And we're going to talk a little bit about, and income and resource eligible. Again, this category does have both an income limit and a resource limit. So some of the criteria for MOD, individual between the ages of 16 and 64. And again, important for folks on MOD or considering MOD, depending on your age, to know this is also a Medicaid category that, that ends, and it ends when somebody turns 65. So just how this category was developed and designed, people have to be at least 16, and through their 64th birthday, they hit 65, they've aged out of this, particular category of Medicaid. Unlike every other category of Medicaid where people are eligible and they get Medicaid free, that's not true in this category. Because this category has a much higher income limit and a much higher resource limit, there is also a premium attached to it. And it's 5% of the individual's countable income. In determining eligibility for MOD, if the applicant is married and living with their spouse, then the spouse's income and resources also count in determining eligibility. But once the person is then determined eligible under this MOD category, then premium is tied just to the applicant's income and not applicant and spouse. So again, medical assistance for workers with disabilities. Worker can mean I have a job. I've got a job. I do it at home. I do it from wherever. I have a paycheck. Here's proof. Here's my pay stubs. This is my job. But the job could also be something much less formal. It could be something that somebody's doing for a neighbor, a relative, a family member. And that, whatever they're doing for them, just needs to be monthly, an hour a month. Maybe it's 20 hours a month, maybe it's 20 hours a week, but maybe it's just an hour a month. Just so they're doing it, whatever the job is, and they're getting paid. And in a scenario that's informal like this, they have documentation from the person that's paying. Hygienist minor, paying my neighbor, Judy Smith, to do such and such for me. She does laundry for me. She does that twice a month. I pay her $40. That's what I'm paying her. I sign it, I date it, I put my name and, my address and phone number on it. So if the county assistance office wants to call to verify that Judy, my neighbor, is, doing laundry for me and I'm paying her for that, then they call me and I verify that. So that could fit the work piece. Excuse me. So there have been many people over the years of the Health Law Project who came to us not working, but disabled and otherwise, 16 through 64, meet all the other criteria, but weren't working over income and or over resources for that Healthy Horizons category or for the, any other category. They weren't pregnant, they were no longer kids, and they were not doing any work, but we advised them about this category. And might there be something you can do that somebody, at least monthly, that somebody would pay you to do and put in writing that they're paying you to do it. And I've helped lots of people over the years get Medicaid under this category. So it's a good one to kind of, hold on to and tuck in the back of your head, especially if you're working with somebody with a disability who's, maybe had Medicaid and then losing it because the income increases. And perhaps that income increase is tied to a job because many folks with disabilities can and still do work. And now it could be that work that put them over the the Medicaid eligibility system should have caught them, and recognized, well, wait, they're over income, but they're all, they're disabled. We should be looking at them under mod. Or just for folks who, don't have Medicaid or lost Medicaid because of income or resources could be eligible under this category if they're doing some type or could be doing and get that in place, some type of paid work. And then in order to be meeting that definition of disabled for the worker with disability category, if the person's receiving Social Security disability insurance, SSDI, then that box is checked. They are already determined disabled. Medicaid, county assistance offices don't need to know anything more. If that person is not receiving Social Security disability, then and working, and perhaps despite their health conditions or disability, want to keep working, then just like the kids category for kids with disabilities, then that individual who's, has some health conditions or disabilities, but not getting SSDI needs to provide medical documentation. Get medical records, get, whatever you have, or have a doctor complete. There's various forms the county assistance office will provide somebody, a health sustaining medication form, for example, or just have a doctor write, something more than Janice is my patient and she has depression, like a little bit more than that. Give us a little bit more about, the diagnoses, medications, how long you've been treating this person, just pull some medical records. Lots of folks now have access to their own medical records, online, my chart, all those kinds of things. But if they're not already getting SSDI, they need to provide something in the form of medical documentation or medical records to meet that, and then again, the medical review team will determine if that person's condition, meets that definition of disability for this mod category. Okay, so I think pretty much just covered all of this, this slide. And then, as I said, that one of the really nice pieces about mod is it has a much higher income limit. It has a much higher resource limit. So, and again, as always, tied to the federal poverty level. So in the case of mod, income limit is at 250% of the federal poverty level. Unlike other categories of Medicaid, for mod purposes, the applicant is either single and therefore a household of one, or they are married, living with their spouse, and they're a household of two. Beyond that, there is no household of 3 or 4 or 7 with mod. It's a household of 1 or a household of 2, whether or not there are, other people in the household like your own kids. And unlike the Healthy Horizons category, where if the applicant has their own dependent children in their household under the age of 21, the resource limit is disregarded. That's not true of mod. Mod does still count resources even when the applicant might have dependent kids under 21 in the household. And then the income counting rules, and this is true under the Healthy Horizons category as well. I talked earlier about kids, adults who don't have Medicare, and pregnant women. They all fall under those Medicaid categories where income, household size, tax filing status. Those are the 3 really important pieces in determining eligibility, with no regard to resources. Doesn't matter what people's resources are for kids, pregnant women, and adults who don't have Medicare. Now, the Healthy Horizons category, the mod category, and the income counting rules are for those categories all tied to the tax filing status of the individual. Is the person a filer, a tax dependent, or neither? And then the rules go accordingly. That's not how income gets counted in the Healthy Horizons category or in the MOD category. For these categories, we're looking at gross monthly income. Doesn't matter about taxes or tax returns or whether or not I even have to file taxes. Well, who else might be in my tax filing household? These rules are more how we would typically think of a household. It's me, it's my spouse, it's just the two of us. We're married and living together. We're a household of two. Doesn't matter anything about our tax filing status. And then they're looking at gross monthly income, and depending on the source of the income matters significantly because how income gets counted. And so I use an example here because that's how my brain works better with concrete examples. So we're looking at eligibility for Medicaid for Joe, who is single, on Medicare, receiving Social Security disability insurance. And that gross monthly amount from his Social Security disability, SSDI, is $1,420 a month. And he's also working and earning a gross amount of $365 a month. So if we go back to the Healthy Horizons slide, you'll see he's over income for that Healthy Horizons category. But he is both disabled and working. And MOD has a much higher income limit. So determine both his eligibility for MOD as well as his monthly premium for MOD. His income gets counted based on the source and type of his income. So what's considered earned income versus unearned. Earned is from a job. Pretty much everything else falls to unearned. So I get Social Security retirement, I get Social Security disability, I get workers' comp, I get a pension, I get unemployment compensation. All those things fall into the definition of unearned income. Earned income is basically formal or informal, a job that I'm doing. So how's income counted differently? For unearned income, in this case, Joe's SSDI, $1,420 a month, monthly gross, they have a just small standard disregard, $20. So they count everything but $20 of his $1,420. But from his countable income, from his monthly $365 he's earning from his job, that first standard disregard is $65. So the first $65 he earns is just not counted, and then count only half the remainder. And then add those two income amounts together. It's $1,555 a month. And again, this is the same way Healthy Horizons category counts income. But if we go back to, what is the Healthy Horizons income limit tied to 100% of federal poverty, it's 12 something. Somebody's flipping back to the slide, for a household of one. So even when we do those deductions at $1,555, he's way over for Healthy Horizons, but he's way under for MOD. And so he's then, based on his situation, working, disabled, between the ages of 16 and 64. I didn't put Joe's age up there, but we're assuming he's in there between 16 and 64. Then he's MOD eligible, and he pays the monthly premium. If he can't continue to pay that monthly premium, he will lose his Medicaid. Always a grace period in there, but this category does have the premium tied to it. So in this case, his premium, if my math is right, based on countable income, and we figured that to be the $1,555, and 5% of that, $7,750, likely it's rounded up to $78 is his monthly premium. And he has Medicare, so Medicare is his primary insurance, but then he has Medicaid supplementing that Medicare because Medicare does not pay for 100% of care the way Medicaid does, with very small copays. Okay. Next category I wanted to touch on, and again, one that perhaps
Sorry,
aren't
this is Megan.
familiar
Can you
with,
hear
and
me?
so this can be helpful to know.
Dennis, we actually have a few questions. So Megan is read them to us.
Okay, sure.
Can you guys hear me okay?
We can.
Yep.
Hi, everyone. It's Megan Liszkowski from TalkHip. We have some good conversation and questions going on around MAUD and medical assistance for workers with job success. So I'm just going to read a few and see if I can summarize them. Well, first, Iris asked if we know if MAUD is determined by health condition or health sustaining meds taken or both.
It's determined kind of more as a whole, you know, in terms of what are the conditions, what are the medications being taken? I mean, I think under our experience with clients applying for MAUD is that the medical review team within the Medicaid office is, I think, fairly generous in how they determine somebody disabled. But certainly, I mean, somebody could be, you know, have a disability that they're not taking any medications. Perhaps, I don't know, perhaps cerebral palsy. I'm just trying to think of things that, you know, so it's not necessarily tied to a condition that requires medication. It's just in the case of conditions that do require medications, that health sustaining medication form can be helpful. You know, having your doctor complete that, you know, my patient Janice has, in my case, Meniere's disease, depression, she's treated for both, she's, you know, here's the medication she's taking for her Meniere's, here's the medication she takes for her, you know, depression, and those two conditions, you know, and that information just on that health sustaining medication form completed by my doctor, you know, could be sufficient for the medical review team to determine, you know, I meet the definition of an adult with a disability, you know, for MAUD. If it's not sufficient, then the county assistants and the medical review team should communicate that to the caseworker, you know, looking at my eligibility and ask, you know, for more information. How is, you know, looking for more, perhaps more medical records, more documentation of how are my medical conditions impacting my functioning. So it's, yeah, so Megan, it's kind of not as just cut and dry of.
Cut and dry, yeah.
Yeah.
And I did, for folks who might want to know some more information in the Q&A section, not the chat, but in the Q&A section, I did answer Iris's question. You should all be able to see that with a link to DHS's page on MAUD. So you can find some more info there. Another few questions came in about ABLE accounts and their impact on resource limits. So specifically, one person asked, does money in the ABLE account count toward the $2,000 resource limit?
It does not. And in fact, it's one of the reasons why ABLE accounts exist, is to be able to, you know, provide people with disabilities with the ability to accumulate some assets without it impacting their Medicaid eligibility, as well as their Social Security eligibility. But again, not our expertise, but I just know it to be true.
Got it. Yes, agreed. And then there's two questions from two different people, but they kind of meld together. So one individual was, Dana was concerned that if she makes over $10,000, will she lose her MAUD?
It's not about making over $10,000. The $10,000 is the resource limit for MAUD, different from her countable income. So if, you know, if she's got money in, you know, checking and savings and a retirement account and some of those things combined that exceed $10,000, then she's no longer eligible for MAUD.
Got it. And again, I will, you know, I'll put that same link to the DHS page in the chat that I put in the Q&A section, so people don't have to go hunt for it. And Christine asked, if a person is not on SSI or SSDI, and they go into MAUD so that they can have Medicaid while working and earning an income, but then they lose their job, does having been on MAUD now identify them as permanently disabled? And now in the Healthy Horizons category? In other words, would going on mod disqualify them from Magi in the future when not working?
No, going on mod does not disqualify somebody for Magi. And when Megan says Magi, she's talking about, you know, those categories of Medicaid that includes kids, pregnant women, adults not on Medicare, that have those special and different income counting rules tied to tax filing status. So yeah, no, there certainly, maybe not off the top of my head, but certainly could be a scenario where, you know, I'm not collecting Social Security disability, but I am in fact, you know, disabled, working. You know, the system, the Medicaid system has verified that such that I have Medicaid under mod, you know, and then I stop working. You know, then it's a matter of, as it should always be for anybody on Medicaid, because everybody on Medicaid is in Medicaid in a category, maybe more than one, because maybe I'm getting SSI and I'm on a Medicaid waiver. So I'm going to be in more than one category. My Medicaid is tied to more than one category. But anybody on Medicaid in any category who loses eligibility because of health conditions, because of income, because of resources, whatever it might be, should always be viewed for every other category, you know, that's appropriate. Obviously, if I'm 25, nobody's looking at me for the kids category, because I'm not fitting in a kids category. But should be reviewed for any other possible Medicaid category.
Thanks. The other questions around this. So there were some folks weren't aware of medical assistance for workers with job success, but prior to that, if we could look at Barbara's question. Barbara's question is a little detailed. Due to her rent cost before COVID, rent price hikes. I'm going to just read it as if I'm Barbara. I'm on mod. Due to my rent costs being before the COVID rent price hikes, I have more income than I can spend, but I'm stuck with the 10K mod asset limit. I'm a few $1,000s a year short in meeting the income amount I need to get moved to medical assistance for workers with job success that would get rid of that 10K asset limit. I'm 58 and need to save for retirement. Have mod folks who aren't quite at this WJS income had any luck being moved into that WJS program? Has PHLP been able to help with this? Should I try asking my state elected officials for help? So I think this is a good opportunity to talk a little bit about WJS and then maybe talk to, maybe if you have an answer specifically to Barbara's issue, go to that.
Okay. Yeah, so what is being referred to here, mod WJS, there is, and I didn't touch on it here. There's the mod category, and just within the last maybe 2 years or so, Pennsylvania has basically created and allowed for another, with the Fed's blessing, another category of medical assistance that's connected to mod, and it's mod for workers with job success. That's the WJS. That category has a higher income limit than the mod category and has no resource limit once you cross over into mod for workers with job success. So unfortunately, the first part of, I think, her question is, no, there is nothing. That it's how the law is currently written. So there's nothing we or anybody else can do to advocate for somebody who is in mod or lost mod because they've got more than the $10,000 resource limit. But they're still under the mod income limit so that they're not moving into mod for workers with job success. Certainly start always talking to a state rep. State senator is a good idea. They're the very folks who helped put this, advocates made this happen, but certainly legislature and governor signed off on it. But otherwise, no. Unfortunately, when people's income stays under the 250% of federal poverty, they're not moving to get into mod for workers with job success that now disregards all resource limits. People have to first be in mod for 12 consecutive months, at least, can be longer, but for at least 12 consecutive months, in mod, keeping their income limit under the countable 250% of federal poverty, keeping their resources on their countable resources, because again, people could have something like an ABLE account, it's not counted. Otherwise, keeping those resources under the $10,000 resource limit, 12 consecutive months, and then their income, their countable income goes over that 250%. They shouldn't be terminated for mod, they should be reviewed for mod for workers with job success. And that has a higher premium, it's 7.5% of income, not 5%. And then when they're switched into the mod for workers with job success, because their income exceeded the 250% of mod's income limit, then they've moved into the new mod category that doesn't count any resources. But for people, and we've seen several people call us, we've had several people, I've had personally several clients in that same situation where their savings were getting above 10,000, but their income was still, their countable income still wasn't above the 250%. And unfortunately, that's currently how the rule's written. The income has to go up first, then get moved. Was there anything else we wanted to try to touch on before we keep going?
I think for mod and WJS, that was it. If we have time, I don't know that we'll have time at the end, but if we do, we can go back to it. Thanks so much, Janice.
Sure, yep, absolutely. So another category of Medicaid, women with breast or cervical cancer, and actually there are some precancerous conditions that fall tied to breast or cervical that also can tie into this category. Eligibility under this category, women under age of 65 diagnosed with breast or cervical cancer or very specific based on ICD codes, precancerous conditions of breast or cervix. They have no insurance or no creditable coverage. So maybe somebody is bought on independent insurance that just covers if I need a hospitalization, or insurance that's just vision and dental. Those would be examples of insurance that, you know, are not creditable and therefore could still allow somebody to be eligible for Medicaid under this category. But there is no income limit for this category and no resource limit. If women otherwise meet this, you know, the criteria. And this category of medical assistance has its own application process. So unlike every other category of medical assistance where people can apply, and we're going to talk through those examples of how people can apply. People who think they're likely only eligible for Medicaid under this category, then don't want to apply directly to the county assistance office. They want to do that through the Department of Health Breast and Cervical Cancer Early Detection Program that some people may know formerly as the Healthy Woman Program. And there's a specific physician form that has to be completed, and then they send that to the county assistance office. And again, as long as there's no other creditable health insurance, and under 65 meet the medical diagnoses, no income limit, no resource limit. And when women get medical assistance under this category, it isn't just for the treatment of their breast or cervical cancer, it's full medical assistance coverage that any other adult would have access to on Medicaid. Okay. Other category for adults, low-income adults under the age of 65 without Medicare. Again, this is what people sometimes refer to as the Medicaid expansion category. And as I said, one of the three groups of people that fall into the, you know, how the income gets counted and how resources don't get counted. So kids, pregnant women, adults under 65 without Medicare, then it's strictly based on income limit. It's that federal poverty level for this category for adults is 138% of the federal poverty level. And again, no resource limit, but we're back to those rules around, is the applicant a tax filer, or tax dependent, or neither? And who is in, their tax filing household, or they're in their household, otherwise, with some relation, like you're married or they're your children, not just, a roommate kind of thing. But again, no resource limit under this category. Pregnant women, I think Emily touched on this, income limit is at 220%, tied again to those tax filing status rules, and no resource limit. And a pregnant woman, you see the chart starts with a household of 2, because there's never a household of 1 when the woman is pregnant. The pregnant woman herself already has us counted, has her counted as a household of 2. So let's talk again about the categories with resources and without, and what we mean, what the system means when we say resources. So, we've touched on all these categories again, just hopefully maybe helpful to have them, together on one screen. These, kids, pregnant women, adults without Medicare, adults with children under the age of 21, unless they're on MOD, people applying under breast and cervical cancer program, children with disabilities under what's coded as the PH95 category, no resource limits for any of these categories. Categories that do count the resource limits: Healthy Horizons, that age 65 and older, or people younger, but with disabilities. Well, I'm sorry, it's right under there, adults with disabilities, and then the MOD, medical assistance for workers with disabilities, as well as the category we were just talking about, the MOD for workers with job success. These categories all count resources with those qualifiers that you see in parentheses. So we've talked many times about resources. What are resources? Resources generally for the Medicaid eligibility system, are talking about what some refer to like as liquid assets. So money in checking, money in cash in your home, money in savings and retirement accounts, in stocks and investments, in a certificate of deposit, money that's generally accessible with or without having a penalty. If it's money I can access, then it's counted as a resource. What isn't counted when we think of resources, the home that you live in. If you own property, house or land, whatever, outside of where you're residing, that's a countable resource if it's yours, or you own some portion of it. Things in your home, jewelry, furniture, microwave, whatever, none of those things are counted as, resources. If you have one vehicle, it's excluded, not counted as a resource. More than one, then they're counting the value of the least expensive resource. If you have a term life insurance policy, which means I have a life insurance policy with a death benefit that has 0 value to me, it's only going to be valuable to somebody when I die, and there's a beneficiary that's getting X amount from my life insurance, not counted. Somebody have burial reserves or a prepaid burial arrangement, bank with funeral home, with wherever, it's prepaid, it's there to go to, burial arrangements, it doesn't get counted as a resource. And again, with the exception of MOD or MOD for workers with job success, if, resources don't count if, I'm a senior 65 and older or an adult with a disability, falling in that Healthy Horizons category, if I have dependent children, my dependent children, not just, any child that might be, somebody who's residing there in my household, but isn't, my legal responsibility. Okay, I'm trying to be mindful of our time. I think I'm going to move through the eligibility examples. People will have them at least, just because of time. I want to be respectful of people's time. I want to try to get any other questions. And I want to, get through the rest of, the presentation. Hopefully they're helpful if people review them. So how do people apply? We've talked all this time about how can somebody be eligible for Medicaid? And anybody can apply for Medicaid at any point. So people don't have to screen themselves. They don't have to figure out, certainly, as I think folks can see, it's a complicated eligibility system. It has all these nuances. It has the rules with the exceptions. So people are certainly, don't take this information and then try to figure out for yourself or somebody else if you're Medicaid eligible. Hopefully this just gives you more to work with, a framework you didn't have before, or information about the eligibility category like MAUD that you didn't know about. But otherwise, when in doubt, encourage the person or people to apply. People can apply online. The state's what they refer to as the Compass website, by phone, by mail, or in person. I would always double check. Ever since COVID, when of course the offices were typically all closed, those offices should now all be open and accessible at the very least to get an application. Whether you get the paper application and take it home and fill it out, or sit there and fill it out. 4 different ways for people to apply. And when people apply by phone, you want to have as much as your information right in front of you before you call, because the customer service rep is literally going to go through the online Compass application. So, you're applying for yourself and your child. You don't know your child's Social Security number. You don't know your bank account number. Best to try to pull that information together before, and then somebody's going to complete that application. Somebody at DHS, the Department of Human Services, will complete it for them. Again, not an all-inclusive list of what you need when you're applying, but these are some of the pretty typical. So people are completing the application or having it completed for them if they do it by phone. But in addition to that completed application, people are providing, copy of Social Security card, copy of birth certificate, something that verifying your identity and your address, if your address is correct on your driver's license, your identity and your address, verification of income. And again, no matter the category, income verification is always required. It may not count in that person's particular eligibility category, but you still have to provide last 2 months pay stubs or something, something verifying what your income is. Most recent bank statements from any kinds of accounts you have. Again, those resources may not count, but generally they're asked for and you want to provide them. Otherwise, it's just delaying your application and perhaps even resulting in a notice saying you are not eligible because you didn't give us X bank statements. And if people have a life insurance policy, provide a copy of that life insurance policy. What the system is looking for there is to see, is it a term life insurance that has no value to you, only to somebody else when you die, versus something like a whole life insurance policy that might have a cash or might have a cash value. That cash value, again, depending on category, can be counted. Just some tips for applying. And we've heard this more, I'd say recently over the last several years. If somebody's applying saying they have no income, it seems more and more that the county assistance office workers want some, verification. If you have no income, how are you living? The response to that may be, in a shelter, place to place, that should be sufficient. But if I'm a 25-year-old adult applying and I have no income and I'm able to be sustaining because I'm living with parents and they're keeping a roof over my head and making sure I'm fed, then typically the assistance office seems to want that letter from those parents saying, you know, this is my 25-year-old living with me. They don't have income. We're not giving them any income. However, they're living here rent-free and we're feeding them. That will suffice. You know, if somebody's working like in an informal job, especially like maybe in the case of the mod category, you know, you need to have documentation of that from whoever it is that, you know, is employing you. If people are mailing in the information, ideally mail it all together, you know, or mail the application first, get that going in the system, because the system has 30 days to process your application. So you can complete, you know, make sure the application is completed, dated, signed, hand deliver or mail it, and then start to work on where's my copy of my driver's license, get my copy of Social Security, all those other things together. But then ideally, sending those all together, excuse me, just really increases the likelihood that everything gets pulled into your case, as opposed to, you know, making a copy of this and mailing it and then making a copy of something else and mailing it. When possible, send things by certified mail, or, you know, a way that's tracking, you know, when possible, but sometimes that costs money. It's not always an option. If people hand deliver either the application and or any of the verifying documents to an actual county assistance office, ask them, and some, I think offices just actually have something right there that people can do themselves, but ask for a state, you know, a date stamped receipt, so that if, you know, that doesn't get matched to your case, and they say you didn't submit it and therefore your application is denied, you can say, I did submit it. Here's the date stamp receipt I have from the person that was at your front desk when I hand delivered. Respond to any requests from the county assistance office, or, you know, if you applied online, look on the Compass account to see if there's any, you know, anything in there that's asking for, you know, and they may, not unusual that they could be asking for something you submitted. Often the path of least resistance is to just submit it again. You can try to reach the worker and say, will you look again? Was it, why was, you know, it should have been scanned in. I provided that bank statement the exact same day I provided my driver's license, and you have my driver's license, you know, look again, and they can look again. But if they're saying it's not there, unfortunately, generally I advise people, take the path of least resistance, and you can argue with them all day long. If they say they don't have it, send it to them again. But try to respond to anything from, you know, phone calls, mailings from the assistance office as quickly as possible. And then the assistance office does have 30 days to process an application. And then, as I mentioned, I think very early on, with the exception of people who have SSI, who automatically get Medicaid, because those communications happen between the Social Security system and the Medicaid system, everybody else has an annual renewal. People on mod or people on mod for workers with job success have a semi-annual renewal. So really important to key into those renewals. If somebody moves, change of address, change of phone number, and as required, if your income changes, your household size changes, you should be notifying the county assistance office. But really important to be notifying the assistance office when you move. And if you move out of county, you actually have to get your case changed, closed in the county you were in, opened in the county you're moving or moved to. But the address change, all of it's important. The address change, really important, because otherwise your annual renewal or semi-annual renewal is going to your old address. And unless that's getting forwarded and quickly, you're missing the renewal. And then you've got a notice out there that, again, you probably don't get, saying your Medicaid's terminated. Now you don't know that until you show up to the doctor or you go to your prescription, whatever it might be. So important that people know, you know, you weren't determined eligible for Medicaid forever. You're determined eligible for a year, maybe just 6 months. And again, responding to anything from the county assistance office, as quickly as you can, even if that response is to try to get to somebody or call that customer service center number, more accessible generally than the county workers and the assistance offices. Even if to get the message to say, I got the notice, I know I still need to get a bank statement to you, it's gonna take me a couple days, or it's gonna take me to payday because I don't have it and my bank charges, and I can't get it until I get a paycheck. Can you get that flagged in the system so that it's in my case and not, hopefully the worker's not gonna send me a notice saying, you're determined ineligible because we didn't get your bank statement. So as much communication as you can do, recognizing, and we recognize it because we do this work every day, that the county assistance offices can be very challenging to get a hold of. If somebody's denied medical assistance from an initial application, or their Medicaid is terminated with a renewal, or because a renewal happened that the person missed, if you're denied and think you're still eligible, appeal. When in doubt, you can appeal, but you should know that if you appeal and appeal timely for the Medicaid eligibility system is it within 15 days of the date on your termination notice. You're entitled to your Medicaid to continue, but it's important that people know you can be at risk of a Medicaid overpayment. If you appeal timely, ask for your Medicaid to remain in place, only to go to a fair hearing, which is the appeal that people are entitled to find out, no, the assistance office was correct. You are in fact over income, over resources, perhaps both, depending on your category. There is the potential that the state comes back for an overpayment for what, not for the care you received, unless you have Medicaid with just your access card, but for whatever the health, the state was paying your physical Medicaid, physical health plan and behavioral health plan. So just, it's not likely to happen, but it does happen. And so we always advise people, just to do that knowingly, especially when people appeal and they're not, unfortunately, are not eligible. And then just some resources that could be helpful for folks. The Department of Human Services, I think Megan was referencing this earlier, their medical assistance eligibility handbook. As you can imagine, it's hundreds and hundreds of pages long, but there you have the link to it. The state's handbook for CHIP, and then perhaps something much easier to digest, our Medicaid eligibility handbook that you can find on PHLP's website, and are also under the resources section of our website. There's lots of other written materials. You'll find information as well as webinars on MOD and on MOD for workers with job success, and our helpline number. Okay. Other questions? I am fine to continue. Obviously, we're at noon, so try to be respectful of people's time. But I'm available. I don't know, Dana, if the webinar is going to cut off at any particular time. But if we have more questions, I'm glad to try to field some of them.
No, we're good, Janice. We just, the webinar will need to end by 1 for another meeting scheduled later, but we're fine for now.
But
Janice,
you're
this
right.
is Megan.
Uh-huh.
Hi, there was one more question in the chat that we didn't get to. Joseph said they have several children in their life sharing program who are permanently disabled and receiving SSI. Are they required to be under a $2,000 asset limit to maintain benefits?
Again, it's a Social Security question and not a Medicaid question.
Yeah, and
It is, yes, it is my understanding that is correct, that Social Security eligibility for SSI, supplemental security income, has both an income limit and an asset limit. And again, with things like the PA-able account excluded, but if somebody is on Medicaid, and the only way that they have Medicaid, their only category of Medicaid is, and in the life sharing program, I'd say probably not. I'm guessing they're in a waiver. But in terms of their SSI eligibility, yes, it's my understanding that in addition to being under the income limit for continued SSI, their resource limit is $2,000.
Yeah, so that's a good point, and Dana and Janice, correct me if I'm wrong, just so we can clarify for everyone on the call in case it's helpful. Regardless of SSI, to maintain medical assistance benefits, to maintain Medicaid benefits, it's highly likely that a child 22 and under who is permanently disabled and is in, if they're in a life sharing program, they're very likely in an ODP waiver, which would make them eligible for medical assistance, correct?
Correct.
Yes.
Correct. Absolutely.
Also, theoretically, if they have a significant disability, they would quite likely be eligible for medical assistance through the PH95 loophole if they were not eligible through a waiver or they were not eligible through SSI. So that's sort of a third door that a child in that situation could access medical assistance benefits, right?
Right, and again, under age 18.
Under age 18 for PH95. Right.
That PH95 category ends at
Ends at 18, right. And those those resource limits are separate from the SSI resource limits. So I think sometimes those get conflated. But just to be clear, the SSI resource limits and the medical assistance resource limits are separate. Unless you only qualify for medical assistance through SSI.
Correct.
Got it.
Correct, yes.
Thanks.
Sure. Any other questions? Anything else in the chat?
We have a couple things coming in through the Q&A. Let me see what those are. We have Tony saying 56-year-old, haven't worked in 2 years due to an accident, can work due to herniated disc in neck and back. Can't work, sorry, due to a herniated disc in neck and back. Living off of my retirement, assets are about $7,000 remaining. Would I qualify for any coverage?
And I'm sorry, Megan, in the beginning of that, did he indicate any income at all besides living off of assets?
They're 56 years old and it sounds like they're only living off of their retirement assets.
Then
Apply?
yes, they could be eligible.
For SSDI.
No. Again, Social Security is a whole different
Oh, okay.
system
Yeah,
and
no.
our expertise. Is a 56-year-old be eligible for Medicaid? Yes.
Yes, so go to Compass, right? Do an application.
Yep, exactly. Yep, yes, absolutely. And again, feel free to call us.
Yes.
And we're glad to do some thorough, a little more screening, get a little more detail. What kind of income's being earned off of the assets that they're living from. Those things will matter.
Yeah, so Tony, if you we did share PHLP's contact information in the chat, but I can type it into the answer here as well. And I'll also share the Compass link because it sounds like we all agree you theoretically could qualify, so you would want to apply for medical assistance through the Compass system. The other question was from Barbara. PHLP, could you email me the number of people in state you feel are in a situation of being on MAUD and having more income than they need and unable to move to workers for jobs with success, medical assistance for workers with job success. I'd like to have that info when reaching out to my state elected officials.
Yeah, and Dana, if you're in the loop on any of this better than me, let them know, but yeah, I mean, I can tell you I've had a couple of anecdotal cases, but otherwise I would not have any of that information, and I don't know that the state has it, or even I don't know that they're tracking it, or even an easy way to track, individuals that were on mod, lost mod because their resource limit went up while their income remained under 250% of federal poverty. I suspect that information is simply not out there.
Yeah, that's what I was thinking, Janice. This is Dana. I think maybe the advocates who worked on pushing for workers with job success are still, involved in monitoring the implementation. So it's possible that those folks might have, an idea, just ballpark of how often this happens. But Barbara, if you, I'm moving around now, I'm en route, but if you could send an email to me, or even to Janice and she can forward it over, I'm happy to try to connect you with that group. I think they just know more than we are. And I have not heard of the state tracking this kind of information either.
Right. And again, my email is on that first slide, jminor@phlp.org. It's on the first slide of the PowerPoint. So yes, absolutely. Feel free to reach out to me, and I know a couple of people Dana's thinking of, we could reach out to them and see if they know any of that information, or anybody's, tracking it formally or otherwise.
Okay, so I don't see any other questions popping through in either the chat or in the and Q&A. So thank you, everyone. I want to take a moment and just say thank you to everyone for your participation, for your thoughtful questions, Janice, Dana. Again, our generous hosts here at Northeastern IU 19, and the Top Hip team, as well as the Pennsylvania Health Law Project, and all of the people behind the scenes. So thank you, thank you, thank you. And we will be sending out the slides as well as the recording, and I hope everyone has a great rest of the day. So,
And Carol, I'm sorry, can I also, let people know that, our presentation today, travel and whatnot for us at the Health Law Project, is all funded by, and again, I think on our first slide, the Pennsylvania Developmental Disabilities Council.
thank you.
And one of the things that's both required and really helpful for them and for the federal, because there's federal funding attached to that state funding as well,
Yes.
is for a survey to be completed. And so, Dana or I could get that survey out to all the folks who registered, who signed on today. And it's a brief survey. If folks can take a couple minutes and complete that, we'd really appreciate it.
Wonderful. Yeah.
And we know the funders really appreciated it.
Yeah.
So it just.
Great. Okay, so yes, so definitely be on the lookout for a follow-up survey from today's presentation as well. We will probably be sending that along with the links and the slides and the survey. So we appreciate you taking the time to fill out that brief survey regarding today's presentation. And again, thank you from TACIP and the Eastern Pennsylvania Special Needs Association. And we hope you have a wonderful rest of the day. So thank you.
And Carol, we'll be reaching out to let everybody know that the next Eastern Pennsylvania Special Needs Association meeting will be happening late summer, early autumn. And we'll keep everyone posted on that as well.
Yes.
Yeah.
Thank you.
Yeah. Thanks, everyone.
Thank you.
Everybody.
Take care. Bye, everyone.
Bye.
Do you know if lunch came?
Yeah, the setup. It should be set up in the
I
outside.
was like panicking. I thought, no, this guy's on the ball. I know that. So, yeah, so I think if the room's still available.
Yeah, we have.
feel free to sit here and eat.
Yeah.
I do the flyer.
with the program. I'll get it for you.
Otherwise, please grab. Thank you for being listening. It's not exciting stuff.
Hey, are you cold? Oh,
Are
see,
you-
Have you seen
Are you getting lunch?
I am gonna go, I'm gonna use the ladies room first, but I am so cold and you're up there with shorts.
I know, but I'm sure, because I'm sure just, you know what I mean? Just,
Yeah,
I was
Well, my
used to-
legs are just my. Especially in the summer. I'm glad I brought this. I mean, it's nice for them, they probably like them full, but
Yeah.
it's a little.
You work for PHLD?
Yep.
Okay, I work for Community Justice Project.
Oh.
So I work under Peter and,
In what office?
the Scranton office.
Okay.
And so I'm very interested in all of this, and it's a good, recap, I guess, for me. Our focus is EMA, and because of the
Yes,
amount of.
because that's who we turn to.
Yeah.
When in doubt, we're like, somebody reach out to Peter or,
Yeah.
who am I blanking on it, CLS.
Oh, I know, I know who you're talking about.
Maripat.
Yes,
I want to say Marissa, and I knew that was wrong. Maripat.
but now we're starting to do more, with the different immigrant categories, immigration status categories, and, because we're getting a lot of mixed status immigrants. So for those that are undocumented, we usually just go straight to EMA. But it's all these other immigrants that are now arriving who are not necessarily undocumented, but are not green card holders either.
Right.
So, I think that more and more this community up here is really going to start facing, at some point, they're gonna be crossing with these different mixed immigration status families. So I'm just trying to like have a better understanding of the most basic MA to
Right.
then, working with Peter, really start analyzing the different other aspects when it comes to immigration status, because it is so complex. Oh my God.
Oh, yeah.
But I mean, I have a whole chart in my office and I like follow it and I'm starting to get the hang of it. But the other day when I saw this, I'm like, I should probably go to this and just get a better understanding of just like basic MA, like just assuming a person is a US citizen. And even this is so complex. Oh my
Oh,
God.
I know, I know.
So I really
Yeah.
appreciate.
Oh,
work
absolutely,
with
yeah,
them.
we really appreciate you guys. because
Yeah.
You said that the whole immigration piece is just
100% complex. There's this one chart that just goes like all these different arrows and I'm like, oh my
I
God.
know, if this, then this, if no, then
Then
yes.
Yeah,
So, I'm sorry, what's your name?
Jenny
Jenny.
Gonzalez.
Oh,
Yes,
nice to
you're
meet you.
Janice.
Yes, yes,
You're a social worker.
yes.
Because I'm a social worker
Oh.
and I always, I haven't seen I think in recent years, I think Plan has hired more and more social workers.
Yes. Yes, yeah, I
Was
was
there an affinity group or something?
there, yes, matter of fact, I'm not sure if they're still meeting. Maybe. I know the person, Rebecca, was kind of, you know, helped leading that, had to step back